This segment is sponsored by Cosmetic Surgery Associates. Cosmetic Surgery Associates is located in Bethesda, Maryland, and offers the latest cosmetic procedures. So joining us today to discuss facial rejuvenation is board-certified plastic surgeon Dr. Dean Jabs. Welcome to Great Day.
Thank you.
Okay, we hear the term facial rejuvenation. What does that mean? What is that?
Well, everyone ages at different rates, but basically what happens as we age is we lose volume in our face. The elasticity of the tissues decreases and we get sagging, and we even lose bone volume in the face. So when we address this, we want to address the skin, the subcutaneous tissue, the ligaments, and sometimes even the bone.
So when do we know when it's time for a facelift?
Basically, people come to me and they want to use fillers and other things, and that doesn't work. When you start to see tissue sagging down, when you start to see big, heavy neck bands, it's time for a facelift. You can see even this sort of thing in thin people, and then it's time to reposition those deeper tissues back to where they go. We do this in our office all the time. We have our own operating room. We're Quad A certified, and we do this under sedation. You don't need general anesthesia to do this.
Oh, okay.
We can do this in about 3 to 4 hours. We can address your eyes, we can address your face, and it gives a long-lasting, really natural-looking result.
What do you say to somebody that maybe you hear the term facelift or surgery that might be a little hesitant or afraid?
We see so many people in our practice that know people that are over-pulled, they're pulled straight back.
Right.
We give a very natural look that lasts a long time, and I can show before and after pictures for a lot of patients, and then I tailor it with an artistic eye to that patient's individual anatomy.
How does it work with, like, when you decide what to do with the eyes?
Well, basically people come in and they say, especially when I put my makeup on and it smears all the time. This tissue is overhanging, and they've got excess skin. So when we evaluate around the eye, we evaluate both where the brow is, we evaluate how much upper lid skin is, do they have bagging on the lower area, and as we age, since we lose volume, oftentimes we have troughs, and those troughs can be filled with the patient's own fat.
Okay. Can you do something about the neck?
Absolutely.
Is that workable?
Absolutely. And what happens with aging is you'll see a generalized sagging. You'll see this portion of the face come down.
Yeah.
You'll see bigger areas here. You'll see neck, like I've got. And what we do is we do a facelift. And I think the options that we have here, really the best option is a deep plane facelift. And that's where we make incisions right here, going around. We lift up a small amount of skin, and then we go under the deep tissues and elevate everything back up to where it was in a more youthful time.
So you're not just pulling this, because you hear the word facelift, right? People think it's like that frozen look pulled back.
Right. I think to be a good plastic surgeon, you have to have a good aesthetic sense as well as anatomical knowledge. And you also have to be able to relate to the people that you're dealing with. And I try to focus and listen to my patients and what they want, and then try to achieve that.
We hear the term board certified. What does that mean? What should we be looking for in a plastic surgeon?
That's a great question. Board certification is, the only board certification that matters is the American Board of Medical Specialties, the ABMS. To be a board certified plastic surgeon, you have to complete certain steps. Typically those include 5 years of general surgery training, or sometimes 3 years of general training, and then another 2 years of plastic surgery training.
Okay, so that's what we need to be looking for.
Yeah,
that's what you have, of course.
That's
you're
what
board certified.
I'm board certified by the American Board of Medical Specialties. You'll see the people make up boards because they want to do plastic surgery, and they're not plastic surgeons. You got to stay away from those people.
So do your research for sure. Anything else people should know before they come to you in terms of discussing facial aging?
Well, they should know that the more effort that they put into it and the bigger procedure gives a better result. We have an Instagram video of somebody coming in and having completely irrational requests with no surgery, and they want all these things. And I say jokingly, I'm looking around for my magic wand, and as soon as I find it, we can do that.
So realistic expectations,
yes.
But you all are the experts, and you can help us figure out what's going to be right. Dr. Jabs, thank you so very much.
Absolute
pleasure. It was very
pleasure.
enlightening. If you want more information, you can go to cosmeticplastics.com. or give them a call at 240-868-6106.